Right. So we had said right bronchial artery. It mainly is a branch of the of the aorta as well, but it can also be a branch of the third posterior intercostal artery, the one for the third intercostal space. Right. Then you said you haven't done neuron. Anyway, when you look at the spinal cord going down from the brain, the spinal cord ends where? Intervertebral disc between L1, L2, right?
Oh.
It doesn't go all the way down with the vertebral column. So here's what happens.
So it ends between L1 and L2.
For adults, then for children, it's between L3, L4. So imagine the spinal cord is arteries called, there's an anterior and a posterior spinal artery. There's one anterior spinal, then there are two posterior spinal arteries, but they're all coming from at the base of the brain. So do you think those arteries will carry enough blood for the spinal cord all the way to the lumbar? Yet they are very, very tiny arteries.
No.
So they are what we call reinforcing arteries for the spinal cord. And they come from this aorta. In the thoracic region, we are using the intercostal arteries that I said are for the intercostal spaces. Right. So these posterior intercostal arteries, they don't only supply intercostal spaces, but they reinforce the spinal arteries with blood. Right. But the reason why I mentioned that is, did you do diaphragm?
No. Sorry, before we go there. Sorry, before we go there, you said the spinal cord is supplied by 3 arteries, 1 anterior and 2 posterior.
Don't worry about those parts. I will do them with the carotid system.
Okay.
The reason why I mentioned these reinforcing arteries is that you haven't done muscles in general.
Muscles we've done.
What about the diaphragm?
No, not in detail.
But you just know that the diaphragm separates the thorax from the abdomen, right?
In the abdomen, yes.
Right. If you look at the diaphragm, it has 3 openings, 3 major openings. There's one, this one. What do you call this white thing here? It's labeled. So this is the tendon of the diaphragm, the central tendon. So yes, the diaphragm inserts into a tendon that is central. So for a structure to move from the thorax to the abdomen or vice versa, it has to pass through the diaphragm. Right. For example, there is this opening which we call the caval opening. That's where inferior vena cava passes from the abdomen, going to the thorax to drain into the heart. There is this one called esophageal hiatus. That's where the esophagus moves from the thorax to the abdomen. Right. Then there is an opening which is not an opening. Which is it's an opening, not an opening. So between muscle and bone here, there's a space there. Can you see the space between muscle and bone there?
Yes.
That's what we call the aortic hiatus or the aortic opening. It's not an opening in the muscle. It's a space between the muscle and bone. That's where the aorta will move from the thorax going to the abdomen. Right. But before it does that, the aorta will give us a very large branch for the spinal cord, which is called the artery of Adam-Quist. Please don't ask me the spelling.
I will write what I think. Artery of Adam.
Adam quits. It's for the spinal cord. Right.
Okay.
So that's basically aorta in the thorax.
Sorry,
remember,
which level of the vertebra is the diaphragm?
Depends with where you're asking from now. Okay, can you look at this diagram?
Yes.
Its lower part, or its posterior part, it goes all the way down to L3. Then if you look at its anterior part, it's behind the sternum, particularly the xiphisternum, which is opposite T9.
No, I'm interested in the posterior side.
The posterior side, the right cruce is attached to L1, L2, L3, but the left cruce is only attached to L1, L2. There's a reason for that. If you just remember that the liver is more on the right side. So for the diaphragm to be able to support the mass of the liver, it has to be stronger on the right side. That's why it is an extensive attachment all the way to L3. But on the left side, there's a very small mass of the liver. So it's only L1, L2. Right. So you want to ask something?
We are saying there is the Adam quits that supplies the spinal cord.
Yes.
From the thoracic artery before it passes through the
diaphragm. From the thoracic aorta before it passes through the diaphragm. Don't call it thoracic artery because they are thoracic arteries that we will talk about later. This is thoracic aorta.
Okay.
Because when you do the carotid and the subclavian, there's internal thoracic and lateral thoracic. So don't call them thoracic.
Okay.
So we also said it will give you branches for thoracic structures, esophageal branches, bronchial branches. Thymus is there, it gives you thymic branches and so forth. Right. But I don't want you to stress about those ones. Anabas.
Okay.
So after passing through the diaphragm, our aorta is now in the abdomen. It will just change name. We'll call it abdominal aorta. Right. Where does the abdominal aorta start? Whilst I look for my diagram.
The inferior part of the aortic hiatus.
Have you ever seen this meme where a boy was asked, name 5 animals in the that live in water? Then he said there's frog. Then he said frog mother, frog brother, frog sister, frog. You have tricked me. No, we want the specific level. It's opposite which vertebra?
Should be L.
No, it's not L.
It's not L.
So if it's not L, it's
Titkoff.
I need a diagram specific kind of the aorta, not this. So the bad thing with doing anatomy in systems is you leave out some things. Normally, when you describe blood supply of things, you divide into 2. There is blood supply of the wall.
Branches of abdominal aorta.
Where?
The third from bottom.
Thank you. I think I'm blind now. So for us to understand abdominal aorta, let's forget the aorta for now and briefly describe about the abdomen. Abdomen is what we call viscera, which are the organs inside the stomach, the kidneys, everything. Then we have the abdominal wall, right, where there is skin, superficial fascia, where there is campus and scarpus. You've done all that.
Is what?
You divide superficial fascia into a fatty layer and a membranous layer. The fatty layer is called Kemper's fascia. The membranous is Scarpa's. You've done that, or it's, I don't know.
No, the two names, it's my first time hearing them.
Okay. Then from the superficial fascia, do you have deep fascia in the abdomen?
No.
Why?
I don't know.
Oh, okay. Do you have deep fascia in the thorax?
Let's explain deep fascia first of all.
Okay, deep fascia is dense connective tissue. So remember, for the thorax and the abdomen, it's almost one thing. The only difference is thorax is ribs. So for the thorax, you've done respiratory physiology. You want to use your intercostal muscles to breathe. So they are contracting almost every second. So deep fascia will hinder that contraction because it's dense connective tissue. So it minimizes the contraction. The same for the abdomen. We are always using our abdominal muscles. Right? So if they are contracting too much, you can't have the contractions more if there is deep fascia. So other books say there is a thin deep fascia, others say there's no deep fascia, but there's no deep fascia there.
So can I have an example of where we have deep fascia?
The limbs. If you dissect the limbs, you see skin, then superficial fascia. Remove the superficial fascia, there is deep fascia.
Deep fascia, okay.
Then after deep fascia, there are muscles, right, on the anterior abdominal wall. Right? You've done rectus abdominis, the anterior one.
Wait, you said after deep fascia?
No, okay, generally after deep fascia, there should be muscles. So if there is a thin deep fascia, there are muscles. If there is no deep fascia, after superficial fascia, there are muscles.
Yes.
The muscles, there is rectus abdominis. Then you did the anterolateral ones, right? External oblique, internal oblique, transversus abdominis.
Yes.
Right. So to understand blood supply for the abdomen, we divide into saying there is blood supply for the anterior abdominal wall, those structures. Then there is blood supply for the viscera. Right.
Wait,
so I want to find a way to make you understand.
There is division into two. One is for the viscera, like the inside organs. And then the other one is for the muscles, the fascia. What?
Yeah.
Okay.
So for now, let's forget that there is this aorta. I just want to describe blood supply for anterior abdominal wall. Because if we start describing aorta, it'll be hard to connect the dots. So for anterior abdominal wall, there are about 6 arteries. The other ones will come from the aorta, yes. The other ones don't come from the aorta. So remember when you're asking me about intercostal spaces, when you said internal thoracic is upper 6, which one is lower 5?
Yes.
Lower 5 is said musculophrenic.
Musculophrenic, yes.
Which is a branch of?
Internal thoracic.
Internal thoracic. The other branch of internal thoracic, it's superior epigastric. Right.
Yes.
So superior epigastric and its inferior, they supply the anterior abdominal wall. Remember I said if you are calling something superior, there has to be something called inferior.
Wait. Did you recall internal thoracic? Okay. Yes.
So I was saying superior epigastric. You say you did muscles and data.
Yes.
Then you did rectus abdominis.
Yes.
It's enclosed in a rectus sheath, right?
Yes.
Then within that rectus sheath, you find nerves for the rectus abdominis, which is T7 to T12. Then you find 2 arteries, one coming from the top, one coming from the bottom, that come and join. which is anastomosis. The one from the top, it's superior epigastric, coming from internal thoracic. Then the one from below, it's inferior epigastric. So,
sorry, so the one from above, we have, which one?
superior epigastric.
Epigastric, superior
Yes.
epigastric.
Which is coming from
And superior means there's an inferior. So from below, that's inferior epigastric.
Yes.
And then the nerves from T7 to T12.
Or as in contents of the rectus sheath.
Yes.
Yeah, there is T7 to T12. Then, what else do you find in this rectus sheath since you are listing contents of the rectus sheath? There's the muscle itself, right?
Yes.
Rectus abdominis, but there's another muscle, the second one. Which one is it? Which tenses the linea alba? It's the muscle is absent in 10% of the people. If you've done P muscles that are absent in people, palmaris longus, upper limb, plantaris, lower limb, psoas minor, posterior abdominal wall, then pyramidalis. That pyramidalis is also a content of the rectus sheath. It's absent in other people, meaning it's not really important.
Okay.
So, question now is, where is inferior epigastric coming from? So, can you do this? Where you are writing arteries for anterior abdominal wall, can you leave space for 4 lines maybe? Then we go back to aorta. Because that's then where you see it.
Okay. So we said, Kutin, panetumor arteries that anastomose, there is the superior epigastric that is coming from the internal thoracic. And then there's the inferior epigastric. Now we want to see where it's coming from.
Yeah, so you can just write that it's a branch of external iliac artery.
It's a branch of?
External iliac.
Yes.
So before I describe the aorta, let's do this. This is abdominal aorta from here. From T12 where it enters the aortic opening to L4 here where it terminates. So aorta ends at L4 by dividing into 2. Let's say 3. It's not 2. By dividing into 3. So it divides
to L4.
Yeah, T12 to L4. That's abdominal aorta.
Yes. And it divides into
3 terminal branches.
3.
Yes.
Okay.
So there is right common iliac. If it's right, that means there's a left. So right common iliac and left common iliac. If this one is right and this one is left, that means the other one is central. So the central one, we call it median sacral artery.
Median?
Sacral artery.
Oh, sacral, okay.
Right. So the other, so those common iliacs, we'll describe them when we go down to pelvis and lower limb, because they'll be going to specifics. Right. Okay. Back to the aorta. This is our aorta here. Right. So the easiest way to describe the aorta is to group the branches. Number 1, there are 3 anterior. Can you see these arteries here? That are coming from the anterior surface of the artery. Right. So there are 3 anterior visceral branches. Anterior means they're coming from the anterior surface of the artery. Visceral, they're going to viscera.
Yes.
Right. Then there are 3 lateral visceral branches. Meaning they're coming from the lateral aspect of the artery and they're going to viscera. Right. Then the last set, we call them 5 anterior abdominal wall branches.
Okay.
And anterior abdominal wall, we are going back to what we were talking about. The anterior abdominal wall, skin, superficial fascia, blah, blah, blah. So those 5, it may look like they're a lot, but they are not. There are 4 lumbar arteries. So you're left with 1 now. So you get 4 lumbar arteries and the 5th one, inferior phrenic.
Phrenic, you said, is diaphragm.
Means diaphragm, yes. But it doesn't only supply the diaphragm.
We have 5 lumbar vertebrae, right?
Yeah.
And then we have 4 lumbar arteries.
No. We have 4 lumbar arteries from the aorta.
Okay. Okay.
Okay. Then inferior phrenic is the 5th branch, that is anterior abdominal wall. So if it's inferior phrenic, where is the superior phrenic coming from? If we said phrenic is diaphragm, this one is coming from an artery below the diaphragm, that's the inferior. Superior phrenic has to be above the diaphragm. It's coming from the thoracic aorta. Inferior phrenic artery will also give blood to the adrenal glands. You've done adrenals, and your suprarenal glands.
I think so.
The way you produce catecholamines, dopamine, epinephrine,
No, we haven't.
You haven't done endocrine, what do you call it? Endocrine physiology.
No, not yet.
I used to love endocrine physiology, but I don't know why I didn't do physiology in the end.
Okay, sorry. So the inferior phrenic artery, it supplies the diaphragm and also the what?
Adrenal gland.
Adrenal gland.
Or you can call it suprarenal gland. So for now, let's start describing the simple ones. The 3 lateral visceral branches, because they are straightforward. One is for the kidney, one is for the adrenal gland, one is for the gonad. Gonad is either testis or ovarian. Why is the blood supply for the testis coming from the abdomen?
Because the
the testis is down there, the ovary is even down there in the pelvis as well.
I think because Parkuzo branch at the other, the Parkuzo branch into the 3, the sacral and the iliac.
No. To think embryology. No, these arteries are, remember we said they'll form common iliacs. The common iliacs at some point will divide into internal iliac for the pelvis, external for lower limb.
Because when an embryo is like, when a kid is being formed, stem cells.
Yeah, stem cells, primordial germ cells.
No, not okay, forget about stem cells. But there's something about my cells moving from the like anozozica, but they're not originally, they're not down there.
Okay, so you form the testes and the ovary in the abdomen initially. Then when they migrate with their blood supply, right? So the three lateral visceral branches, there is renal artery for the kidney, right? Then renal artery for the kidney. Then there is testicular artery if it's a male, then ovarian artery if it's a female. Right.
Can I ask?
Yeah.
Are these coming with left and right?
Yeah. So, I had forgotten to mention this. The three lateral visceral, they have left and right. Mm-hmm. But the three anterior visceral, they are 1-1.
Okay.
They are not paired.
Okay.
So there is renal artery, then there is gonadal artery, which is either testicular or ovarian. Then the third one, we call it suprarenal artery. It's going to the suprarenal gland. So suprarenal artery. Suprarenal gland is what we are calling the adrenal gland. Okay. So far, so good.
Yeah.
Now to get to the hefty part now. Then there is the three anterior visceral now. These ones are the weird ones. So we did embryology together. We said we divide GIT into foregut, midgut, hindgut. Right?
Okay.
Yeah, we can open and see where we wrote that. So that division for the abdomen was based on blood supply. Right. The artery for the foregut, we call it the celiac trunk. Here it is. It's formed at T12.
Okay, wait, I was distracted. We are talking about the three anterior visceral, and then you said the gut is divided into 4.
The foregut, the midgut, and the hindgut. It's 3. That's why we have 3 anterior visceral.
Okay.
The artery for the foregut, it's the celiac trunk here, which comes around T12. Right. Then the artery for the midgut is this one. We call it superior mesenteric artery. It arises at about L1. Right. Then the artery for the hindgut is this one. So if there's a superior, there is a inferior. So that this one, we call it inferior mesenteric. It arises at about L3. Right. If you want to be fancy, it's given off 3.9 centimeters above bifurcation of the aorta into the common iliacs. Right. So question now is, do you now want me to talk about these arteries to say the celiac trunk moves like this and how it will supply the stomach, the pancreas, the liver, and everything? Okay.
Yes.
So remember I said if it's a trunk, it means it's carrying a lot of things, right? So it divides into what and what? This one, it's nice in the sense that it divides into 3. So of the 3, there's a larger, there's a smaller, and there's the intermediate, right? So those 3 should have names. What are they? This diagram is not doing what I want. There used to be a diagram, I've seen it before. It's not a good diagram either way. Well, what are the three? This one is good. Like branches of the celiac trunk. It gives you three. So there's a splenic artery, meaning it's mainly for the spleen, right? That one is the largest.
Okay.
Then there is a left gastric artery. That one is the smallest. Right. Then there is a common hepatic artery. This one, that's the intermediate. Right. So someone would ask, why is it called common?
Because it will then divide.
It would divide again, right?
Yeah.
Right. So let's start with the smallest, which is left gastric. You did all these organs, right? Stomach and stuff.
Yes.
So stomach is this curvature here, lesser curvature, right? Then it is this greater curvature here on this other side, right? So blood supply on the lesser curvature comes from arteries that end with gastric. Blood supply on the greater curvature comes from arteries that end with gastroepiploic, or you can call them gastroomental. So any artery that we are going to see, which is gastroepiploic, it's coming to the greater curvature. Then any artery that we're going to see ending in gastric, it's coming to the lesser curvature. Of those arteries, if it's left, it's for the upper part, be it left gastric or left gastroepiploic. If it's right, it's for the lower part.
And then is the curvature, gastric.
Sorry?
I'm trying to write down everything you said. Greater curvature, it's a gastro.
Epiploic or gastroomental.
I'll go with gastroomental, it's easier.
But you also need to check if it's the one that you used your side.
Okay.
So I was saying the left ones, they supply the upper part. So if it's left gastroomental, it's the upper part. If it's right, it's the lower part, right? So celiac trunk has given us left gastric, right?
Okay.
So celiac trunk gave us left gastric, common hepatic, and splenic.
Splenic, yes.
Right. Meaning left gastric is for the upper part of the lesser curvature.
Yes.
Then it also gives blood supply to the lower third of the esophagus. So stomach and esophagus are continuous, right?
Yes.
It also gives blood supply to the lower third of the stomach.
Of the esophagus.
Of the esophagus. Okay, yeah. Then the splenic artery. Did you ever talk about something called the stomach bed? Where if you're in the supine position, your stomach will be resting on it, the upright position rather. The stomach will be resting on a bed.
Okay.
Which is formed by structures called there's a mnemonic. Let's try to kick 6-7 stones per day. One of those structures is the spleen. So this is just a diagram trying to put the spleen there, but the spleen is behind the stomach. Right. So this splenic artery, It's also behind the stomach. Can you see it there?
Yes.
Right. And if it was if it was a full depiction, the pancreas would be here. The pancreas.
Yes.
So what I'm drawing is also behind the stomach. Right. So splenic artery travels on the upper border of the pancreas as it goes to the spleen. So whilst on that upper border of the pancreas, it gives branches for the pancreas. Such that if you go into a lab, if you try to lift the splenic artery, you lift the pancreas as well because of the branches going into the pancreas.
Okay.
Right. Then before it enters the spleen here, it gives us two branches. Not two. Okay, two named branches. Number one, it gives us what we call short gastric arteries. So spleen, yeah.
So the gastric and gastro-omental, they only apply when we're talking about the
stomach.
About the left gastric artery, because I can see the short gastric artery is on the greater curvature, not the smaller curvature.
Okay, this is not greater curvature of the stomach, by the way. This is the fundus of the stomach.
Yes.
Greater curvature starts somewhere here going down.
Okay, but it's not on the lesser curvature. That's my point.
Okay, yeah.
Yes.
So short gastric arteries, they come from the splenic artery.
Okay.
So splenic artery gives you 5 to 6 short gastric arteries that supply the fundus of the stomach. Right. Then it also
5 or 6.
Yeah, 5 to 6.
Okay.
Then it also gives you a left gastro-omental, which you can also call left gastroepiploic. For the upper part of greater curvature.
Okay.
And so there is short gastric arteries, then there is left gastro-omental.
Okay.
Then it enters the spleen to supply the spleen. Right.
So it's not dividing into this, it's just giving rise to other branches.
Yeah, it's just giving branches. It enters the spleen as a splenic artery. Then in the spleen, it divides into what we call trabecular arteries, but that will now be histology.
Okay.
Right. It's saying less than a minute.